Welcome to Balanced Care Conversations with Equilibrio Home Health, the podcast that bridges the gap between innovative healthcare technology and compassionate home care. In each episode, we dive deep into the transformative world of healthcare solutions, exploring everything from physical therapy to the latest developments in skilled home healthcare. Join us as we engage with industry experts, healthcare professionals, and technology pioneers who are reshaping the future of home-based care. Whether you're a healthcare provider, caregiver, or someone passionate about advancing healthcare solutions, this podcast delivers valuable insights, practical strategies, and inspiring discussions that help create more balanced, effective care environments. Subscribe now on Spotify, Apple Podcasts, Amazon Music, or your favorite podcast platform to stay at the forefront of healthcare innovation.
Moving on to one of my favorite topics as we get into a great area where this is going to segue into Victor is doing in-service with us in a few weeks. And typically students that do 6-week internships do an in-service about 3 or 4 weeks into it, where they pick a topic that relates to not only their interest, but what can help the field that they're doing an internship. So we're in home healthcare, but technological and evidence-based practice. We're going to look into this question here is how has the integration of technology in physical therapy practice influenced challenges or opportunities you've observed in implementing technological advancements in various clinical settings? And I know that you'll be doing an in-service that leads to this, so I'll let you kind of get into that as well.
Yeah, this is a great question. I love technology, especially when it comes to physical therapy. I feel like it will only help the profession even grow even more and give us a lot of different avenues to create more interventions for different patient diagnoses. Right now, I'm focused on patients with neurological impairments such as Parkinson's, stroke, dementia, stuff like that. But in general, I feel like technology is streamlining the access to things like research and support articles and telehealth. Now you're able to even get direct access online. Pre-COVID, that was something that probably you couldn't do. So that's I feel like that's really important. Some challenges to that, I would say, could be the cost and training of having new technology come in and being able to train a lot of your staff members on how to use them, on how to apply it to different patients in order to get some real data points from patients from day-to-day visits to see how they're improving and to be able to track that continuously and be able to evolve and give them a better tailored care that they would. Right now, I'm focused on, researching on how virtual reality VR will help in individuals with the stroke population. Right now, the current CPGs, like the clinical guidelines that we're supposed to follow, is mostly dealing with aerobic training, getting them to walk, doing functional activities and functional tasks, which is something that we do, that I see a lot in home health, getting the patients up and moving. But then if we can incorporate something like a VR, patients can be able to be more engaged and be able to get up and walk even longer, because it's different than just walking across the street or walking in your house, but having that VR system in, it might place you in a different environment that might help get those motor neural circuits firing and have the patient hopefully recover faster than just traditional physical therapy. So that's where I'm at with that right now. I think technology can only help us. Of course, it comes with some setbacks like any other thing, but future, that's where we're going. And we just got to embrace it.
Yes, sir. I think that you are right on the money with that. I'm all about technology too, as you know, with trying to develop our scribing, artificial intelligence dictating system to be more efficient with getting our notes done. And we've already seen an improvement with, I've sent some of our notes that we see with patients together to you through a secure email, or it's better than writing and taking notes and having to put that on paper, the old fashioned way of just taking notes, where now we have a way to dictate everything that we're doing, which helps to I think, improve accuracy. Because sometimes if you're in a rush, you may not be able to read your handwriting or you may forget some different things. So if we're recording what we're saying and what we say is accurate, which it should be because we're professionals and we should always be positively sure about how we say what tests we're doing and how we're explaining it to patients. But I think it makes us better professionals, to be honest, when we have those types of technologies that kind of back us up, but they also keep us on our P's and Q's or keep us sharp as far as what we're doing and saying, because we know it's getting recorded and we know for the accuracy and validity of what we're doing, we have to do the right thing or try to do the right thing. And if we're not correct, we just can correct ourselves down the road. But physical therapy is, it's an exact science, I guess. So we always are perfecting what we do and trying to make it better.
So, reflecting on your journey as a physical therapist, how would you say that the emphasis on evidence-based practice has evolved in terms of what roles do you think hands-on experience plays in physical therapy, and how do you interpret and apply certain research findings that you get into actually seeing patients and your interventions?
Wow, that is a great area because we implement this right now, to be honest, with evidence-based practice and um, our balance in life program that we utilize, which is a 4-step process. Some people ask, why would you want to use a 4-step? It's kind of like the person that says, why does 4-minute abs not work as well as 7-minute abs? And I'm just saying that hypothetically is because you have to troubleshoot how a process can help a patient the best. And I figured by looking at certain standardized tests that we learn in school, such as oculomotor testing, standardized balance testing using the foam cushion we have called the modified sensory integration test. And then we also have a Sims-Weinstein monofilament test where we use a little test that we prick the patient's bottom of their foot. And then we can also use some gait index tests with how they walk with turning their head, like I mentioned earlier, a straight line or looking up and down versus turning and making a 360-degree turn. So we're doing various testing and then we're quantifying those scores and placing the patient, placing them in a fall risk category. And the last category we always look at is their cognitive ability. And if they have dizziness, natural dizziness, which would be called vertigo. And vertigo for the general public is when a person is feeling like the room around them is spinning. So not necessarily you're spinning, but you're still and you feel like you're tilted to the right or left or the room is spinning. That is a vertigo, a positional vertigo. And we as physical therapists can, diagnose and get rid of that with certain treatments. So we came up with a 4-step system based on science of those tests working. And then we figured the best way to implement those tests is to start with the oculomotor testing to see if a patient can track a pen or an object, just keeping their head still with their eyes, and then to switch from an object and look back to the center to see if there's any slippage of where the eye moves. So we're looking at neurological signs doing that, central signs from the brain to the eye. And then from there, we look at visual ocular reflexes, which allows the patient to turn their head left to right and see if they can keep their eyes focused. And that will cue us in if they do have a true positional vertigo, or they may just be losing their balance because they've got a poor, what we call visual ocular reflex. So these are great to start with. Oculomotor tests are always number one. They're easy to do for patients that aren't looking forward to doing a lot of physical type stuff their first visit. We break them in with these, and it often, I'm not saying impresses the family or the patients, but it's a good way to look at some neurological systems. And it's a basic thing we learn in school, but we incorporate that into our daily practices as physical therapists, especially in the home health setting. So that's a good example of how we're using evidence-based practice or standardized tests that we learn in school. And then we can learn the efficiency of statistics of how doing some of these tests and diagnosing some fall risk issues can prevent falls. So we look at statistics in the elderly, or I would say 80 and older population, and how it makes them safer or less of a fall risk when we identify these areas. And then we really start to improve the strength of whatever system is weak. So it could be their visual system. It could be their somatosensory system's a little weaker. It just depends on what system's the weakest. So basically my reflection on how, evidence-based practice has allowed me to evolve into our balance in life program, which is a 4-step program. And I only say it only works in 4 steps. You can't make it 6 steps. You can't make it 7. I challenge anyone out there to try to prove that it would work better with different steps. And I think it's a good debate, though, and it helps us evolve as healthcare professionals to have those discussions, because maybe someone can figure out a way then I put my ego aside and say, hey, what you found is going to help patients better. But it started with me coming up with that 4-step process. Now we're moving on to our last category that we're going to get into in this podcast today is the future of physical therapist education, or the future of education in any kind of physical therapy environment. So, Victor, looking ahead, how do you envision the ideal balance between theoretical learning and practical experience in physical therapy education? And what innovative approaches or technologies do you believe could help achieve this balance?
I love that question. I'll say the ideal balance, personally speaking, this could vary, from you might have a different answer, which I would love to hear. I'll say personally, the ideal balance will be 60% practical experience and 40% theoretical learning. I feel like having 60 and 40 gives you a good balance, and it complements each other, where you have some hands-on experience, but you also have the evidence-based practice that you were referring to earlier to also back that up. In terms of innovative approaches, and I would say using more expanded use of simulation labs is
Mm-hmm.
definitely helpful. Back on campus at University of St. Augustine, we have a lot of simulation labs where you can go in and have a full scale anatomy of the body and just go through and break that down. And then we can also go to the cadaver labs from that
Yes.
simulation to actually look at real bodies. And because it's different, from just looking at labs and then actually seeing a real body and dissecting it and seeing where the tendons insert and attach. So having those balance, I feel like complements each other. To me, it's 60-40. To somebody else, it might be different. I will also say in incorporating more interprofessional education, which is something that I feel like the University of St. Augustine
Mm-hmm.
does very well. We, as PT students, often have classes where we deal with some cases that we work with other professionals, such as OTs and the speech therapists. Being able to work on those cases is I feel like it's important, because that's what you see in the real world. Right now in Equilibrio, we have speech, we have nursing, we have PTs. Being able to work with different groups, PTAs, OTAs, is important. And the only way you can really know how to do it is, being introduced early on in school, so that by the time you're in the real world, it becomes pretty natural.
Well, I think that's great. It's technologies are always going to provide good biofeedback, like ways to learn things. So we not only use biofeedback to help our patients with understanding if they do this, they can feel this different. So that makes them able to replicate the movement we want, or I guess strengthening the muscles we want. But for learning, I think institutions like your institution, even my school, as I went to Gannett University for my graduate school up in Erie, PA, and you're at University of St. Augustine, there's a lot of different biofeedback learning tools, I think, that they utilize with you, Victor, or even your classmates, to drive home certain methods or techniques, so that you're doing them right, because this is how the feeling should be when you're doing it right. And another thing I've got to mention is the checking blood pressure is a skill, but they teach you guys there really well how to get everything lined up right, and the right sounds to listen for. So it's a simple thing to do, and yet I see a lot of people not really do it. A manual test, old school blood pressure tests, when they're using a cuff that well. We're using a lot of electronic devices. So you have to be able to get the brachial artery and get to the right area. And there's certain ways to check that. And that's another example of biofeedback techniques to be sure that you're getting the right results.
And that comes with practice.
Oh yes, practice, definitely. Yeah, you got to keep practicing, and you may not be perfect all the time. Nobody is, but you can always strive to get as close to perfect as possible. And I think that's a good thing.
Okay, and the last question, which I think is the most important one, is to you, Matt. What would you say is the most critical skill or experience that cannot be replicated through digital learning or through education? Or what could you say is just you have to actually be there and do it yourself tomorrow?
I would say you have to be there presently. I think it's kind of like when you've got people that want to get into music industry and they're playing instruments, you got to get away from, I guess, just putting in a streaming stuff online or on YouTube or even on TikTok, and just get in front of a live audience, right? And start performing. So you're getting a real live dose of that with this internship because you're in front of patients in their homes. So you're seeing real issues that they might have there, real life family issues, also healthcare issues. I think that it's important to always get in front of real patients and real people that have real medical issues or just anything in life, because we're finding right now in home healthcare, I have to talk from a home health perspective, not just from an outpatient or rehab setting perspective, but there are things that inhibit patients from getting better at home. And it could be a lot of family members in the home that are smoking and doing other things that are counterproductive to that patient's well-being, or just an argumentative environment, which increases the anxiety and stress of the patient. And that could increase their blood pressure and other issues that we're trying to keep normal with their cardiac meds or just, other disease processes. So we don't want to go into a home and say, you guys are okay. We're not being judgmental, but you don't know that from just looking at clinical books that we study at school or just the classes that we take with our professors. So we have to take the knowledge of, there are classes, you could probably attest to this, Victor, that maybe teach you how to get across your points to patients from different socioeconomic backgrounds, different ethnic backgrounds. So we're not only communicating with Caucasian men and women, African American men and women, maybe Asian or different types of Filipino population, or it could be just anything. It could be a Hispanic population. So we have to know how to best communicate with the people that we're trying to help. And sometimes that might mean learning a few of something about their language or something from their faith, if it's a religious belief they have. So we can't go visit them on a Friday for maybe somebody that's Jewish because it's a Sabbath. So we have to, these are intangible things that we should try to consider to make it better for them to really truly get the best out of what we have to offer. Because if we're going to go see a patient on a holiday where they can't have therapy, or we force them to do that, I don't think it's going to be that productive, because they're going to be feeling uncomfortable, and they may not be, if we're not willing to respect their religious or their beliefs, they're not going to be wanting to trust us for future visits and everything we have to offer. So it is a trust process, but that's something that you have to learn by being in front of patients and just experiencing how to help different people. Quite honestly, I've learned the hard way sometimes. I've had differences right out of school with patients, and I've had to learn, maybe in that situation, if I could go back and do it again, I would just listen to the patient more, or just put my own beliefs and ego aside and listen to what they're saying and just meet them where they're at. I know where they're at may not really help them down the road because they're not giving me what I need. But if I can take where they're at and try to push it in the right direction with earning their trust, that's all the difference I need really as a physical therapist. I just need them to start doing a little bit of what I'm asking. And then when I get their full trust, they'll start listening to everything I'm saying and doing. We're trying to educate them on. And basically, in a nutshell, I think you can't always rely on digital learning tools with measuring function and strength, or some of the cool things that we mentioned earlier today that you mentioned with your doing virtual reality type rehab training, which is excellent. I think it's amazing. Do you have any final remarks on that topic or that area with digital versus actually getting into the physical person and helping them?
Yeah, I'll add to it. I would say a couple of things that you really can't replicate. The main thing I would say is the human interactions. I feel like that you have to be able to handle what the person
Yeah.
is saying, not scripted. Is how they could tell you they're in pain, they're really in pain. They could tell you, in classes like we do, which I give them credit. We do a lot of case-based scenarios where I'm playing the PT and another student is playing the patient, and even doing manual muscle testing on them. Quote unquote, we're still healthy individuals, so they might not be able to give you the type of range of motion limitations or strength deficits that you actually see when you go out in the field and deal with a patient that has a stroke, and like this, and see like the rigidity and the spasticity on the arm. It's way different than somebody can replicate. Even online, you can't really get that. So I think the manual therapy, the human connection, those are the main things that just can't be replicated online or digitally. You just have to be in front of a patient and just figure it out.
Yep. There's no good substitute for just jumping in and learning how to do something and just talking to people. You're right. Well, that brings us to the end of this episode on bridging the gap with Equilibrio and our balanced podcasting series. And it's been great to bridge the gap between me as the more experienced physical therapist, DPT, to one of our younger up and coming doctors of physical therapy who's going to be excellent. I want to say Victor knows what he's doing, but more importantly, he knows how to convey his knowledge in a nice way to patients or make them always setting them at ease. So Victor, I think the future is bright for you and what you're going to do to help be a force for good in the world and the communities that you help, whatever field you're in, whether it's outpatient, rehab care, maybe even home health care. So this has been a great topic in bridging the gap between theory and practice in physical therapy. And I just want to say thank you, Victor, for being able to be on this podcast and take part in it. And we look forward to doing many more of these with you and maybe some other students in the future as we get into some other topic areas. So in closing, I do want to mention we encourage not only us, but all of our listeners to reflect deeply on the questions that we brought up today and share insights if they're following us through Spotify or other platforms to bring up areas that are important to them to hear about as far as this area with bridging the gap or maybe other areas in healthcare that are specific to home healthcare. And we want to get different perspectives to contribute to the ongoing dialogue about enhancing physical therapy, education, and practice. And we ultimately want to help benefit the future for all professionals such as myself and other nurses and healthcare professionals, along with the patients that we help every day to try to give them the best outcomes possible. So that is our goal at Equilibrio Home Healthcare. And really, I think should be the goal of any healthcare professional is using everyone's knowledge and ability and trying to make the biggest impact to be a force for good in the communities. Thanks again for being with us, Victor.
Thank
and
you.
We appreciate you. All right.
Thanks for tuning in to Balanced Care Conversations with Equilibrio Home Health. If you found value in today's discussion, be sure to catch our next episode on Spotify, Apple Podcast, or wherever you get your favorite podcast. For more innovative healthcare insights, detailed resources, and the latest in skilled home healthcare technology, visit us at equilibriohh.com. Until next time, keep striving for balanced, innovative care solutions that make a difference. Remember, the future of healthcare starts at home.